All right, we will call the Health and Human Services meeting to order. Let's do the roll call, Madam Clerk.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Daub.
Here.
Commissioner Anderson.
Here.
Commissioner Colleen.
Right here.
Chair Baker McCormick.
Here.
Quorum present.
Next item, please.
B, Chairwoman's remarks.
I have no, well, I'll just say, we were in the last couple of meetings talking about whether I could use a procedure called general consent. After reviewing the commission's rules of procedure for our committee meetings, there was no indication that I could not use the procedure. But after discussing it with Commissioner Bell, I will be consistent with the other committees and use the same format as other committees. So just wanted to let you know that I will continue to use, or I won't use the general consent. All right, that was my remarks. Next item, please.
The approval of the April 20th, 2021 meeting minutes.
Is there a motion?
Yeah, Colleen, and I support Commissioner Anderson. Colleen.
It's been moved and supported. Any objections? Abstentions? If none, the motion has passed. Next item.
D, unfinished business. There was none listed.
Next item.
Item 1, under new business, an update from Dr. Mohamed Hamami regarding COVID-19.
Good afternoon, Madam Chair.
Welcome, Dr. Hamami.
Thank you. I would like to share the screen just for a quick presentation on where we are today. Can you see my PowerPoint?
Yes, we can.
Very good, thank you. So as always, we are talking about the week before. So this is the period of May 2nd to the 8th. And we'll start with the confirmed cases. We are on the right track. This is the 4th week in a row where we are seeing our cases declining. The number of total cases that were reported during last week were 1,789 cases. That is close to 33% less than the week before, where we were at 2,672. The same is applying to the number of deaths that are being reported as well. Last week, there has been a larger number of deaths than expected, but it is due to some data dump that the state does every now and then where they update the causes of death. It is not because of any spike in the virus or in the infections. These are things that over the past year we have been observing. Our testing capacity still remains to be solid and robust, and we are seeing more testing as we go along. This is the 14-day look back, and if you remember a couple of meetings ago, that trend was going upward. Now it is going in the right direction, and we would love to still see it continue in that way. This is, they say, a picture is worth 1,000 words. These are the ebbs and flows of what we have been experiencing since the beginning of the pandemic. As you can see, we had one peak in March and April where we thought that was a decent peak. It is modest considered to what we have experienced back in December and what we experienced as well in the past month or so. But again, the good thing is that this steep slope is going down, and again, we are on the downslope of this peak. Our positivity rate goes back to the single digits. As you can see, we were as high as 16%. For this period, we at the county are 9.5%. and the state as well at 8.9%. So again, all these are good indications for the improvements in what we are seeing. Our top 10 communities are still relatively the same. We have absolute numbers of cases that have decreased. However, the percentages still are within the limits of what we have been seeing in the past, almost the past year. Dearborn remains as the community with the largest percentage of cases out of Wayne County at 10%. Taylor and Canton come with 8% of the total cases. Westland at 7%, Livonia and Dearborn Heights at 6%, Redford, Hamtramck, Romulus at 4%, and then Inkster and Belleville at 3%. As far as the variants, still the most dominant variant is the UK variant, the B117. We have a total of 862 cases, and then we have relative lower amounts of the others, specifically the 2 California variants, the South Africa. Last time I reported to the committee, we had the P1, which is the Japanese / Brazilian variant. We had 3 cases. Now we're up to 13. And we have received from MDHHS a confirmation that we have currently 3 confirmed B16172, which is the India variant. These are 3 cases. 2 of them are in the same household, and we are conducting the contact tracing. We identified 4 more of these 3 cases that are connected, and some had a connection with someone who had traveled to India. We are still looking over these cases. My apologies, it should not happen. We are still looking over these cases and continuing to monitor that. In terms of school-related cases, we only have 1 new outbreak. There are several that we are still monitoring as ongoing, but we have only 1, which is in an elementary school in New Boston, 8 positive cases in both students and staff. Our vaccine inventory is good. We continue to receive amounts as needed. The state has shifted back to, instead of allocation, to more a request. We know that several of the health systems are skipping some of the weeks and not ordering more than they need. Our total inventory so far, we have received 200,098 and 222 doses, and we administered 162,683 in total, and we redistributed 66,924. If we want to look at the number of doses that we have administered between the Pfizer and the Moderna first doses, we have already administered 83% of our first dose inventory and 74% of our second dose. We, as everybody else is experiencing, we are seeing a lower uptake of the vaccine, and therefore our shipments are now going back to not ordering more than we can use. Our vaccine sites, as you know, we have our standard 2 sites at Schoolcraft College in Livonia and Wayne County Community College in Downriver campus in Taylor. Those are now operating at 6 days a week capacity. We have established 2 new sites at Flat Rock Community Center and Wayne County Community College in Belleville. These are also operating at 6 days a week capacity. We are starting 2 new sites. Tomorrow will be the first day. Tomorrow will be extended hours. I believe the hours of operation are from 11 to 7 or noon to 7. I can double check on that. And these 2 sites are at Lincoln Park Community Center and Wayne County Community College in Harper Woods. The goal is to, tomorrow it will be the first day that we're starting. The goal is to establish 6 days a week operations as well in the next week. We are boosting our emergency preparedness staff to manage these new locations, and this is where the schedule will become 6 days a week. So we have 6 sites that are able to provide any number of doses between 1,000 to 3,000 a day. Of course, we are not seeing that, but we are prepared to do so. The other things that we are working on as well are community micro sites or micropods. These would be 100 doses at maximum. We're working with faith-based organizations, community centers, and some of our municipalities where there is a high social vulnerability index as well as lower vaccine intake or vaccination rate, and we are looking to establish pop-up sites, we're calling them, and doing those as needed. We are also working with the schools. Tomorrow will be our first school clinic at South Redford School District, I believe. Yep. At South Redford School District in Thurston High School. We also are going to be at Plymouth County School on May 13th, Van Buren Schools on the 15th, and Northville Schools on the 22nd. We are working with RISA, and we have a meeting this morning with the school superintendents. We will be holding school vaccination clinics for students. Currently, we're focusing on high schools, but with the news that the vaccine is going to be available for 12 to 15, then middle schools are going to be included. And we believe this is a win-win situation where many of the students cannot drive, and maybe their parents are at work or challenged with transportation. So taking the vaccine to where they are, working with the schools, is a strategy that we are endorsing and we are going through. I wanted to throw two slides. Many of you have contacted either me personally or the health department and asking about the Michigan Lighthouse data and how can we get this data in a more informative way. The data, excuse me, the data is kept by, excuse me, is kept by the state, and the state updates this data on a daily basis, I believe. We have the ability to download the data, and with it come reports. So these two reports are useful in understanding what is happening in out of Wayne County, excluding the city of Detroit. So as you can see, these graphs on the left are those that are fully vaccinated. That means everybody that had 2 doses of the Pfizer and Moderna and 1 dose of the Johnson & Johnson. The one to the right are anybody that have received at least 1 dose. So if we want to look at anybody all over Wayne County 16 and over, then our vaccination rate for fully vaccinated is 40.5%. If we look at anybody that received 1 dose at least, then the number is higher, it's 55%. Of course, there is a 3-week lag or 4 weeks lag for the second dose, and this is why. So in 4 weeks, this fully vaccinated will be 55%, and it will be more. The good thing about this is looking at those that are 65 and older. Of course, these are the most vulnerable, our senior population, and we have 74%, almost 75% of our senior population in Wayne County that have been fully vaccinated, and 84% that have received at least 1 dose. Now, the question that everybody asks is, I want data for my community. At this point, this data is available only through the census tract level. And census tracts are challenging because census tract can include different zip codes, more than 1 zip code, and it cannot be limited to a municipality boundary or a community boundary. We are talking with the state, and they told us that this requires geocoding for the boundaries, which they are not doing at this point. For us to be able to get every community rate is a very much labor intensive and it has to be done manually. We have reached out to the Department of Technology and Information Technology, and we're looking at some software that can take the census tracts and translate those to zip codes and then the zip codes to communities. But I wanted to give you those 2 pictures. On the left is anybody between the ages of 16 and 64 that are fully vaccinated. And even though you cannot see which city is what, it's more by zip codes, but just based on the numbers that you can see, then between the ages of 16 and 64, we are still below the 40%, and based on the shades of crimson that you can see, we are between 10% to probably 40%. Very few in this county map, very few are green where it's 60 and 70. But if you look at ages 65 and over that are fully vaccinated, that picture transforms completely. And most of these are green with higher shades of green. And we're looking at anything between 60% to 90%. So I wanted to leave you with this visual. And again, I know that many of you want data that relates to your community in terms of percentages. We are working on this. I ask for your patience. I am more than happy to answer any questions if you have.
Thank you, Dr. Hamami. Terry Marecki, Commissioner
Thank you,
Marecki. Yes.
Thank
go
you,
right
Madam
ahead.
Chair. And thank you, Doctor, for explaining the lighthouse, because that was my first question. So this is helpful information that I will relay to my leaders. The only other question I had is, as far as the schools are concerned, how does that work with students and parent approval of the vaccinations? Do they have to, do the parents have to sign off on a?
Yes, yes,
okay.
absolutely. Absolutely. It is, again, it is similar to the school immunization program. So parents should provide a consent form, and only students with a consent form will receive the vaccine.
Okay, great. All right, I'm all set. Thank you for the update. Appreciate it. Thank you, Madam Chair.
Thank you, Commissioner Marecki. Commissioner Dodd.
Thank you, Madam Chair. So I have a follow-up question on the schools program. So how are the parents being contacted for that program?
The schools are going to be handling the communication. So similar to how they currently convey any communication with the parents, this is how it's going to be. Of course, we are making it public information that this is something that we're doing. But in terms of when we are going to be there and when students and vaccine are going to be available, then that is the school.
It's all being handled by the school district. Okay. And then, sorry, I have a whole bunch of notes that are just scribbled down here. When do you have any idea about when we will be allowing minors 12 to 15 at our county clinics to get vaccinated?
As soon as it's approved, Commissioner. So now, I guess, since the FDA has approved it, the CDC is expected to issue a recommendation by tomorrow or Thursday. Then there is the ACIP that has to give the final recommendation. Then finally, the state has to endorse it. The minute we hear from the state that it is ready, then any of our 6 sites are going to be expanded to vaccinate children 12 and over.
Okay, great. And then finally, so this the Census Tract Map that is on the screen right now, can the commissioners get copies of this? And then is it possible for us to get updated maps maybe once a week or every other week, or I don't know how often you get updates?
So the data, I know that access to the data itself has to be done by the state, but these are PDF files that we can get. So I can check with our epidemiologist because he's the one who puts these beautiful things together. If we can get them on a weekly basis, then certainly we can send them to commissioners.
Okay, yeah, that would be really helpful for us. And one final question, what is the difference between the Lighthouse database and the MICR?
So the MICR is the registry where any kind of vaccination is entered. So let's say I pull your file, Commissioner, which I don't have access to it, so don't worry. But let's say I pull your file, it will have everything that is recorded by your provider, your childhood immunizations, whether you had a flu shot or not, including your COVID vaccine. So this is your profile in terms of vaccination. The data, the Michigan Lighthouse is specifically for vaccination rates for the COVID-19. It has nothing beyond that.
Okay, so is Lighthouse pulling data from MICR?
Yes.
Okay,
Yes.
all right, got it. All right, that's all I had. Thank you, Dr. Hamami. Thank you, Madam Chair.
You're welcome.
Thank you, Commissioner Dobb. And Vice Chair Colleen, Commissioner Colleen.
You, Madam Chair.
Mhm.
Dr. Hamami, good to see you. Thank you for the work you've been doing and managing through this very difficult situation and just how on top of it Wayne County is. So thank you. I'm going to put in my bi-weekly plea that the data that you show us gets sent to commissioners in a social media format so that we can be sharing it with people. You know, PDFs just don't. So if that's possible, please. Two things I want to talk to you about, Dr. Hamami. One is the variance. And you know, I've been talking about this right from the beginning. I want to know, because I pay attention to the news reports all around the world. I pay attention to what the public health officials are saying. You know, we're lucky to be right across from Windsor, and we get great information out of the CBC and the Canadian folks and that, and just all over the world. And I'm hearing cautions that with the variants, then the number for herd immunity or community immunity, it pushes those numbers forward. So instead of 70%, the variants make it 75%, 78%, 82%. So the numbers are great. They're going down. Vaccinations work. Who knew? And so we're limiting, at least in our state and to a certain extent in our country, the prey species that are out there for this variant or for the COVID. It's out hunting every day, and you get vaccinated and you're no longer being hunted. But it's still raging around the world. So now we have seen a variant from India where it's really raging. So from you, Dr. Hamami, what is your concerns right now about the variants, right? Because they seem to think the UK variant was a big driver down in Florida, and now Florida's seeing a big rebound after spring break. So tell us about variants, please, Doc, and your comfort level, or what are your concerns with that?
So far, Commissioner, most of these variants, according to the CDC, are considered variants of interest and not concern. And the definition by the CDC is that there hasn't been any clear confirmation that they are resisting the vaccine.
Okay.
There might be maybe a modified response or something, but we do not have any indication that the vaccine does not work. So that is strategy number one. Vaccines should be our ultimate goal. We know as well that if you limit the spread, then you are depriving the virus from the opportunity to reproduce, and by reproducing, going into mutations and creating more variants. So again, any of those precautionary measures that we know that worked in the past are still working. So vaccination, I think I called it the Swiss cheese approach. You layer 6 different slices of Swiss cheese. Now all the holes are aligned and you have one solid block. So every layer of protection that we add, whether it's the vaccination, whether it is the face covering, still within, it's still a good idea, whether it's the physical distancing, all those are going to be things that would limit the seriousness of the variants. We hope that we will never see a variant that completely evades treatment as well evade the vaccine. We are not there yet, and again, hopefully we are not going to see that. Now, in terms of we are discovering variant, I believe, and you and I talked about this at one point, Commissioner, the variants are here, we're just discovering them. It is not that just last week we received those 3 cases. Right. I believe we started looking for them, and those numbers are going to be higher. Again, let's take the P1. We started with 3, now we're at 30. So So this is inevitable, and again, the best policy is prevention by vaccination, protection, and that would be what my personal opinion.
Yeah, thank you for that. So it's concern is what the CDC is expressing. It is my concern too, because even apparently with that coding it that way, a few of these variants are more infectious, not necessarily more lethal, but that keeps the spread going. The other thing I want to discuss with you, and you're exactly right. I was just talking with my administrative assistant today. I'm masking up for some time here yet because of the variants and that sort of thing. But my official story is I bought all these damn masks and I'm going to use them. That's my official story. The other thing is, now there's a lot of talk. We're not going to get to 70% fully vaccination, right? We have 10, 20 million people that haven't gotten their second vaccination. And with the threat of variants. So from where you sit and where you're looking at it, it doesn't seem like this is going the route of polio or of smallpox, where we get everybody. So it's seeming to me, and this is where I need your professional opinion, that we're going to be having a leaky boat with this COVID around for some time yet, and maybe an annual kind of threat. And so is there talk, I don't want you to get into it today, but are the public health officials talking about, yeah, okay, if we don't get to the herd immunity or the community immunity, how are we going to manage this going forward next year, the year after? Are those conversations, I don't need to get into what they are today, but are those conversations underway? And are we kind of making plans for, okay, this is kind of the way it's going to be after we get to whatever, 68?
Absolutely. I believe these thoughts are on everybody's mind, and we follow, the NIH and the CDC, and I'm sure there are talks about what's happening. But I guess I am a more half full kind of guy. So since December, we are now early May. In 5 months, we have reached 50%. And I'm optimistic that we will get there. It's going to be harder. It won't be as fast because we know that everybody that wanted the vaccine already got it by one way or the other. We are dealing with those that are hesitant. We're not addressing those that are anti-vaccine. I don't think anyone can change their mind, but those that are hesitant, and specifically the age group, the young between 20 to 40, I think these are the ones that need a little bit of a push. They probably don't see the urgency. They believe that the virus isn't as serious or lethal to their demographics. And this is where a lot of education, a lot of awareness, working with the schools is going to be a plus, where we are overcoming some of the barriers and the challenges, but also educating both families and students and the youth. We are putting together a media campaign. We are looking at where are some of the low rates and some of these concentrations where we need to put our efforts. But as you said, it is something that we need to consider if next winter comes in and we are still at 60% or 70%. What are some of the things that we need to put in place? It is something that not only public health professionals should be thinking about, it's probably the whole public, especially those that are still considering not to get vaccinated. If they do not get vaccinated, then we are not going to see a resolution or some source of back to normal as we are hoping for. So again, the message is, if you're still on the stand lines and you're still not certain, then seek information and seek credible information. Get into a discussion with your provider why you don't want to get vaccinated, and maybe your provider can change your mind and we have the vaccine and you can get it anytime you want.
Yeah, and all right, that's kind of it for me, but I'm with you there. I want to make sure that we have enough in our budgets for the ongoing educational stuff that's going to need to be done. You know, you look at the Wayne County numbers are separate from the Detroit numbers, where the vaccination is much lower. And of course, that means it's circulating more in Detroit, which means it's circulating more in Wayne County. So yeah, as we go forward and we're getting, you know, the help from Washington on this, that we properly fund your effort and our public health effort for what might be more of a long-term siege in getting to where we need to be. So thanks again for your work, Dr. Hamami, and thank you, Madam Chair.
Thank you.
Thank you, Commissioner Colleen. And Dr. Hamami, thank you again. Just a quick question about the Johnson & Johnson vaccine. Where is that being administered? What locations or location?
So we are offering it per request. We are allocating certain days, and specifically at Schoolcraft College, because we had lower supply of Moderna. So at Schoolcraft College, we have days where we are providing Johnson & Johnson. We're using it as well in some of our community events. You'll be surprised, Madam Chair, that our call centers does have calls of county residents that ask specifically for the J&J vaccine. So we're very encouraged with that, and we still have vaccine to provide. So that is still available, and it is given on certain days at Schoolcraft Community College, and we can allocate different days and different places as the volume and the need increases. Our call center is up and running 5 days a week, and any county resident can call and request a specific vaccine, and they'll be given an appointment for that one.
Okay, and testing locations. How many testing locations do we still have up and running?
I believe we still have close to either 7 or 8. Those are still on the website, and they're drive-through locations, and they're available again during the hours of operation that we have previously announced.
Okay, and do we still see a need for the 7 or 8 testing locations due to the fact that we may not, you know, get the numbers of folks coming through?
I believe we do, especially now with the variants and the speed of transmission. It is certainly still our recommendation that if you have been exposed and or you are having symptoms, then the only way of knowing whether you have COVID or not is to get tested, even if you're vaccinated.
Mm-hmm. And do we have the numbers for the testing sites? The number of
number of tests that we have?
Tests, yes.
Yeah, I do have those. I didn't put them in the presentation. I'll make sure next week. But we're averaging close to 2,000 tests a week now.
Oh, okay. So the numbers
at
are
these
still,
sites, yeah. We're a little we're a little higher at Garden City Hospital, but yes, we have a good system in place. And again, nobody that needs a test. I cannot see anyone complaining that they do not have access to tests.
Great, great. Well, thank you again, and thank you for you and your team and all the work that you guys are doing, and to Carol and Janelle, and Miss Jordan was on the line for a minute. Oh, I'm sorry. Commissioner Anderson had a question before you leave. Sorry about that.
Thank you, Madam Chair. Dr. Hamami, I just wondered how many of the cases are directly related to where the testing is going on? Because if it's, I would assume that if an area doesn't have a real vigorous testing going on, they're probably not going to show the high numbers, correct?
I wouldn't say that, Commissioner, because we are not the only ones that are doing testing, and those cases, when we pull them from the state database, these are all reported cases. So any lab that is performing the test has a positive case would enter it in the MDSS, which is the database, and this is how we get it. So it's not only where our testing sites are, it is throughout the county, and we have tons of labs and providers that are providing the tests.
It just didn't seem as though it would be accurately reflected if you had as far as the percentage of positive testing.
Correct. No, this is this is across all. It's not specifically our testing sites. It's all over the county.
So then the cases then are attributed to the community that they live in.
Yes.
Okay.
Yes.
All right, thank you.
Yes. Yeah.
Thank you,
Thank
Madam
you,
Chair.
Commissioner Anderson. Okay, are there any other questions from commissioners? If none, we will let you go. Thank you so much
Thank you.
again
Thank you, Madam
for
Chair.
the update. Okay.
Absolutely. Thank you.
All right. Next item, Madam Clerk.
Item 2, requesting commission approval of a grant agreement with the U.S. Department of Homeland Security Federal Emergency Management Agency.
All right. Is there someone here to talk about this grant?
Good afternoon, Commissioners. This is Shantika Ballard with the Management and Budget Department, the Director of the Grants Division. So this would be the funding for the vaccine plan that Dr. Hamami discussed. The funding would include 6 sites. That would be the Schoolcraft College, the Taylor Wayne County Community College, Belleville, Wayne County Community College, Harper Woods as well, the Lincoln Park Community Center, and the Flat Rock Community Center.
Okay, so is this additional funds or is this?
So this is,
go right ahead.
this would be the FEMA allocation. So the overall plan is going to be funded from a few different sources. FEMA taking the lion's share. And what FEMA requested was that we give a projection of what we thought our need would be in order to develop and implement a vaccination strategy for the masses. So what we came up with initially was $72 million. And what FEMA has done for the vaccinations is give an advance of 50% of what we believe our initial need would be. So we are asking to receive the $36 million, and that will be for a spend. Initially, we asked from FEMA March 15th through June 12th, and we have gone back and asked for a scope change just because with all of the moving pieces of this massive project, we ran into a few challenges in just getting, everything lined up. So we asked to push the date back, in which FEMA did approve that. So our start date is actually going to be April 19th and go 90 days from then.
Okay, thank you. Commissioner Killeen.
Yeah, thank you, Madam Chair. Is this $38 million part of the, I think this one is called the ARP2, where there's distributions from the feds to all of the counties around the country? I think the number for Wayne County is somewhere in the $340 million. Is this grant part of those dollars, or is this a separate grant that we're getting? Separate, beautiful.
Yes, Commissioner. So this will not reduce our, as I call it, ARPA allocation.
Beautiful. What do you call it?
ARPA, ARPA, ARPA.
Oh, I'm missing an A. Seems like everything is ARP coming out of Washington these days. Thank you very much.
No problem.
Commissioner Marecki.
Thank you, Madam Chair. I've asked this question. I'm going to just keep asking it until I get an answer, because I think things are evolving as time goes on. But I'm thinking about the 2 communities, Dearborn and Livonia, that really, they received vaccines from Wayne County, but they did everything themselves, the overtime for the fire department, you know, the space rentals, all that type of thing. I know they've been using some of the CDBG funds that they get, but is there any plan to reimburse those communities or at least help them out with their funding? And I don't know, someone had mentioned you can't like double dip in FEMA, but I didn't know if you could get FEMA funds if you had been using other federal funds to help fill that pot back up. Do you know that? I mean, it's kind of a complicated question.
I think I follow it, Commissioner. So I don't want to give you an incorrect answer. So what I can say is I'll follow up on exactly what the funding situation is for Dearborn and Livonia. Right now, we are not reimbursing Livonia and Dearborn. We are sharing allocation of the vaccination with them. But in terms of funding, no. And it's very detailed with FEMA. So if that was our plan, we would have to write for that, ask that permission of FEMA and get that approval. So we couldn't just make the decision to reimburse them for expenses that they're taking on. And likely the reason that they didn't opt to go into a partnership with the county is because they are having other funding sources, which is what I believe would be the case, but I won't say that as fact. If that is the case, we could not give them federal dollars if they are already receiving federal dollars for that purpose.
Okay, so I get, and thank you for that. I guess that maybe they have to check out with the CDBG funds that they can use that for the vaccinations. So maybe they are getting an okay from that. I'll have to look more into it too, because I haven't talked to them in a couple of weeks about it. Mm-hmm. So that makes sense what you're saying, but I'm going to just find out if they had to get special permission for those federal funds, and then maybe they couldn't get any FEMA funds.
And if there is a conversation that needs to be had, Commissioner, in terms of assistance, I'm definitely open to working with the other community partners. So if they're, grants division or someone from leadership wants to reach out to the county, they're more than open to do that. I believe we already did extend that offer with Dearborn.
Okay, and there's a Brandy Isaacson in Livonia, and I will contact her and see like what's going on there at this point.
Yes, and I know CDBG and some of the other grant sources, they all have carved out, a bit of funding for this initiative.
Okay, all right, thank you very much. I'm all set,
You're welcome.
Thank you, Commissioner Marecki. Commissioner, oh, nope. Thought you were asking a question. Oh, you do have a question, Commissioner Anderson. Okay.
I'm hitting the wrong little symbol. I wanted to mention that on the call this morning, the bi-weekly call, the COVID update, I believe one of our members of Congress, and I think it was Congresswoman Tlaib, indicated, if I'm not mistaken, that the feds, under this new legislation that passed, the COVID bill that passed, that local communities can be reimbursed, but someone would need to check into that. But I think I'm pretty sure that was mentioned this morning that they could be. So just,
great.
You might want to double check it, Commissioner Marecki. And
yeah, thank you. Thank you for that.
All right, thanks.
All right.
For approval.
Is there support?
Yes, I didn't even hear the.
Okay.
Somebody move it.
Should have unmuted myself when I seconded.
Yes, Commissioner Dobb moved it and you support it. So thank you very much. Any objections? Any abstentions? If none, roll call, please.
Somebody was saying something.
Roll
Yeah, I'm
call,
just gonna
please.
ask if we were gonna vote, but we are. Go ahead.
Okay, Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. Motion pass. Next item. And actually, let's take these are all first contact program development for juveniles. Let's take those together. A motion for those 3 through 6.
I'll make the motion, Madam Chair.
And then we'll have discussion. Is there support?
I'll support. Job.
It's been moved and supported. Discussion on item 3. Any questions? All right. How about item number 4? Oh, Tim Colleen, I'm sorry, Commissioner
Yeah.
Colleen, you had a question?
Yeah, that's fine, but it's really for all of them, Madam Chair. I don't think these are the only 4 first contact programs we have in the county. And would somebody from the department please go through the funding mechanism here one more time about how we're able to fund these programs?
Good afternoon, through the chair. Shanetta Coleman, Division Director for Juvenile and Youth Services. What you have before you, Commissioner, is I think 4 of the 8 first contact programs.
Okay.
And to answer your question, the funding mechanism for them, they are not at all supported by Wayne County General Fund, but they are supported through the state funding child care fund plan. And then the provider requires a 50% match, and the provider then matches the overall costs associated with the services using eligible funds that the county that are in compliance with what the child care fund requires. So in other words, could not be matched with any other state funds, but it could be matched with fundraising and other, eligible funding mechanisms.
Yeah, thanks. So these organizations like Alternatives for Girls, they put up the half and then the state of Michigan matches that?
That would be correct.
Okay, yeah, it's an interesting way to fund things, and I just wanted people to be aware of this, that we're able to run this program. Well, you got to do a little management and maintenance of it, but basically we're running this program on somebody else's dime to get it done, that there's not a big investment from the county to make this happen.
That would be correct. The county, obviously, you have your management staff that you may reference to. The county does monitor these programs for compliance.
Right.
But the majority of the funding that is used to support these programs is in part from State of Michigan Child Care Fund and 50% in part from the provider itself.
Great, because this is a very good part of our juvenile justice program in the county. Thank you very much.
You're welcome.
Thank you.
Thank you, Commissioner and Ms. Coleman. All right, so we were on number 3. Any questions on 4? Or basically, Ms. Coleman just spoke to all of these in the funding. So I don't know if there are any other concerns for number 5.
I have a
Sure.
quick question for Ms.
Mhm.
Coleman,
Ms. Coleman?
if that's okay.
Yes,
Yes.
ma'am, I'm here.
Hi, you know what? I'm trying to, something's probing my memory that there was some talk years ago about changing the funding as far as these organizations, the way they could contribute their 50%? And did that just kind of go by the wayside?
No, not at all. What happened, and that action actually did occur, Commissioner. What happened years ago, there was a composition in terms of what was considered eligible funds. And in some cases, it probably predates some of the commissioners' tenure on HHS, but the county used to have upward to about 17 providers. And those providers were using a number of funding strategies, some of them which were not eligible under the Child Care Fund requirement. So the state actually really solidified, or I should say narrowed its definition in terms of what's considered eligible funding. What resulted in that change is a reduction in the number of first contact providers. So where we used to have a larger pool of providers, because the funding mechanism that had been used in some instances became ineligible, it reduced the number of providers who had the eligible funds. So it did occur. The net effect meant we had less providers. So yeah, no, your memory is absolutely on target. It's just the opposite. Instead of having more, we ended up with fewer.
Okay, and so, but it's worked out for us?
It has. It's worked out from the extent that we have providers who can meet the eligibility, and we've not had any challenges. It continues to be a bit of a challenge in that we really would like to grow the number of providers, because the more providers we have, the more access that will be available to young people in their communities. One of the things that make these programs work and be very effective is access in neighboring communities where kids don't have to worry about catching buses or parents getting them to a program. So that's one of the benefits. So when we have fewer providers, they only have a capacity in which they can take on so many youth. There are case ratios that are required to be met. So it has not benefited us in that regard. We had a little bit of a break, I'll say, last year, unfortunately, due to COVID, where kids would normally be engaged weekly with their provider. That was reduced, obviously, because we couldn't do the in-person, face-to-face in all cases. In most cases, we did a lot of virtual work. But we have continuously looked to expand that pool, and will be moving more than likely really soon. So this is a one-year option we want to exercise, but we do recognize that we want to move forward with another RFP to try and expand the pool of providers.
Okay, all right, thank you for that refresher.
You're welcome.
Thanks.
Thank you, Commissioner Marecki. And to that point, how do we, the county, monitor the programs?
Sure. So the county has a number of what we call contract managers internally. They are community service specialists, and what they do is that they are assigned a number of these contracts, whether it's a care management organizations or the GAPS, or in this instance, the first contacts. Each of them are assigned a number of providers. We have 3 tiers of compliance review. We do what we consider a case file review through our electronic database, making sure that case notes align properly with what is being billed for in terms of contacts. So they're doing that. They're checking case file notes. They go on then and they do what we call a self-audit. They verify all the information through self-audits and verification. And then annually, they also conduct an in-person case file audit where they're going into the organization, going through their paper documentation as well. So it is a 3-tier quality assurance process that is actually overseen by one of our program managers. But so they do very vigorous review, making sure the case notes align with, if you say Johnny was at your program, we should be able to go in and look at the day and time that you billed us for Johnny's participation. We should see that in his case notes.
Okay, and that's once a year?
We do 3. So we have a scheduled review plan. So there's the case file in person. There's an electronic, all that we're looking at case files electronically. And then we have what we call a self-assessment audit. So the county is verifying the information as well. So it's being done 3 times a year.
I see. Thank you.
You're welcome.
Are there any other questions? Okay. We can now, we covered item 5 and item number 6. Any questions? All right. If there are no further questions, then we will move for a vote. It's been moved and supported. We can do a roll call vote.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. So the motion passed and there's no objections or abstentions.
Thank you.
Next item.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item.
Public comments.
Are there any public comments? Would anyone in the public like to make comments? Can we make sure that everyone is unmuted? And did we get any emails or?
No, we have not received
nothing-
any emails.
Nothing in the chat room. All right, last call. Any public comments? There are no public comments. Next item, please.
Adjournment.
Is there a motion? Okay,
And
Through the-
or I'll make the
through the-
motion.
Through the chair,
yes.
I'm sorry, the clerk advised that we didn't have a vote on the minutes. So before you adjourn, can we have a vote on the minutes, please, so that they can move them forward?
Move to approve the minutes.
Support.
It's been moved and supported. We can take a roll call vote then.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. The motion has passed. And next item.
Adjournment.
I'll make a motion to adjourn. Anderson.
Support.
It's been moved and supported. Thank you all.